Okay everyone, welcome to anatomy lecture number 7. Today we're going to talk about the core muscles. That's the muscles of the abdomen and the lower back. As always, the content that's presented in today's lecture builds on the previous lectures, anatomy 1 through 6. So please make sure that you are familiar with that material before you move on to this new material. With that being said, we'll have a little recap on muscles, origin and insertions. Just to refresh your memory, each muscle has two ends that attach to a bone, the muscle's origin and the muscle's insertion. The muscle's origin refers to the muscle's proximal attachment, the end of the muscle that's closest to the torso or to the midline of the body. For example, the bicep that's illustrated in yellow in the image here, its origin is located in the shoulder. So this is the proximal end of the biceps muscle. The muscle originates up in this area here. At the opposite end, we've got the muscle insertion, and the muscle's insertion refers to the distal attachment, the end that's furthest away from the torso or from the midline of the body. For example, the biceps insertion occurs below the elbow joint. When a muscle contracts, the insertion will move towards the origin. In our previous lecture, we talked about the different types of muscle contraction, and we said that when muscles contract, they can only generate force by pulling. Muscles are not able to push, they can only pull. So as a muscle contracts, generally we are referring to it shortening. As the muscle shortens, the belly of the muscle pulls on the tendon is attached to the bone, and then the bone is pulled in the direction that the muscle is shortening. That results in movement at a joint. So generally speaking, when a muscle creates movement, the insertion will move towards the origin. Mentioned tendons there, we've covered them previously, but just again to recap, tendon is a tough cord of fibrous connective tissue that connects a muscle to a bone. So in the middle of a muscle, we've got what we know is called the belly of the muscle. Then at either end of the muscle, the muscle fibers will gradually give way to connective tissue, which becomes tendon, which then attaches onto the bone. So the tendon is fixed to the bone, it attaches the muscle in place, and that facilitates movements. So muscles are attached to bone at their origin and their insertion by tendons. Ligaments, on the other hand, connect bone to bone. They are similar to connect to tendons in that they are both made of tough fibrous connective tissue, but tendons tend to be a little bit less elastic than ligaments. You want tendons to be fairly stiff because when you want to generate movement, you don't want any give in your tendons. So imagine if your tendons were elastic, like an elastic band. As your muscle contracts and pulls on it, if it were elastic and stretchy, the tendon would stretch and then the bone would follow afterwards. Whereas what we want is for the muscle to contract, for that force to be passed through the tendon to the bone, and for movement to occur efficiently. So tendons connect muscle to bone, ligaments connect bone to bone. Okay, so moving on to the new content today, we said we're going to talk about the core muscles. Specifically, we're going to look at the muscles of the abdomen and the lower back. So in the little illustration here, we are highlighting in yellow some of the muscles that we are going to talk about. So we see from the posterior view there, some of the muscles going from deep through to superficial, and again from the anterior view, from deep through to superficial. We've got layers of muscle that we're going to talk about here. So the individual muscles we're going to talk about today are the Linea Alba, the diaphragm, the Transverse Abdominis, the Rectus Abdominis, internal and external obliques, the Multifidus, and the erector spinae group. So let me switch over to my model here, and we'll get on with it. So the first one we're going to talk about is actually not a muscle. I said we were going to talk about the core muscles, and I listed this amongst the muscles. But before we start, we'll mention the Linea Alba, not a muscle. It is highlighted in yellow there. It is a thick fibrous band that extends from the xiphoid process. So if I isolate that out, the xiphoid process is at the bottom of your sternum here. So this bone here is your sternum, your breastbone. At the bottom of your breastbone, you've got this little point here, which is known as your xiphoid process. So your Linea Alba is a thick band of connective tissue that extends from the xiphoid process down and attaches on to the pubis symphysis at the middle of the pelvis here. So this connective, this big thick fibrous band is a site of attachment for many of the core abdominal muscles that we're going to talk about. So it's an important structure because if you look at the anatomy around our core there, if I strip back just to our skeleton here, we said in order to create movement, our muscles have an origin and an insertion where they are attached on to bones via tendons. So if we look at pretty much any point in the body, we've got a good scaffolding of bones for the muscles to attach onto. However, at the front of our abdomen here, we've got an area with less skeletal structure, skeletal mass. So this linea alba that stretches down from your xiphoid process to your pubis symphysis gives us that point of attachment on the anterior surface of the abdomen for some of these abdominal muscles. So they will originate on different bony structures, and they'll insert onto the linea alba at the front here. Okay, so the first actual muscle that we want to look at is a deep muscle. It's one that you should all have heard of before. It pops up there immediately, and that's your selected the wrong muscle there. Your diaphragm. Okay, so your diaphragm is a big dome-shaped muscle there. So if we look up underneath, we can see this big dome-shaped muscle here. It originates again on your xiphoid process. If you isolate it out and just look at it on its own, it originates on your xiphoid process, so we can see it attaches on just in there, and it also attaches onto the internal surfaces of your ribs. So we can see again on the inside of these ribs there'll be a site of attachment, and it also attaches on at the back to some of your vertebrae. So this big dome-shaped muscle here, and what the diaphragm does is it is the muscle that is responsible for assisting with breathing. So when the diaphragm contracts, the diaphragm will pull down, and that creates negative pressure in the chest cavity here, and because we've got an area of low pressure being generated here relative to the area of high air pressure outside, air will pass into the lungs, and respiration can occur. We can extract oxygen, we can deposit carbon dioxide, and respiration occurs. We don't need to go into the details of respiration here now, but that's what's important. As the diaphragm contracts, it pulls down. It creates negative pressure in the chest cavity. That area of negative pressure allows air to flow in from the high pressure area outside. Our lungs are filled with air. Then when the diaphragm relaxes, it creates high pressure in the lungs, and the air moves from the lungs out into the atmosphere again. So that the diaphragm is a deep muscle there. Consider it part of your core muscles, because when we are in the weights room, when we are exercising, we want to be able to brace ourselves properly. I'm going to talk a little bit more about that in a moment, and you'll talk about it in your strength and conditioning practicals as well. We want to be able to brace the core. And that's something that you hear said all the time, and being able to take a proper breath and brace your diaphragm as well as the other abdominal muscles and that we're going to talk about now is all part of being able to brace and stabilize your midline. So that's the diaphragm, the first muscle we want to refer to there. Okay, if we layer up or add another layer in, what we start to see is some of our abdominal muscles appearing here. So this first or deepest proper abdominal muscle here is called our transverse abdominis muscle. The transverse abdominis lies deep to all the other abdominal muscles. They all sit on top of it. It originates on, zoom out there. It originates on ribs 4 through 7. It also originates on the iliac crest at the back here and along the side here. and this muscle inserts onto the linea alba at the front. The action or function of the transverse abdominis is to compress and provide structural support to the abdomen. It's involved in trunk flexion, rotation, and lateral flexion. So trunk flexion is bending forward when you flex the trunk, so like in a sit-up type movement. Rotation is when you're going to rotate from side to side, or lateral flexion is when you're going to bend from side to side. So your transverse abdominis is involved in all of those. Compresses and provides structural support to the abdomen, trunk flexion, trunk rotation, and lateral flexion of the trunk. So some exercise examples, if you wanted to really specifically target the transverse abdominis muscle, some Pilates like type exercises are good. So single leg extensions, or things like a plank where you bring your knee to your elbow, where you're challenging that stability of the midline there, and really looking to lock in and compress the core. Will bring in your transverse abdominis muscle there. So that's the first of the kind of traditional abdominal muscles that we want to refer to. Next up, we've got the rectus abdominis. So we see if we add the next layer in, we get the rectus abdominis. Now that is what we kind of traditionally think of when we consider our abdominal muscles. The rectus abdominis originates actually on the pelvis. So if I select him there, isolate, we can see the rectus abdominis originates down on the pelvis, on the pubic symphysis again, and it inserts onto the xiphoid process at the bottom of your sternum there, and it also inserts onto ribs number 5 through 7 there. So with the origin down here on the pubis symphysis, when we contract the rectus abdominis, we're going to pull the insertion, which is up here on the ribs, and the xiphoid process is going to move towards the origin. So it's going to be involved in trunk flexion. So that traditional kind of sit-up type of action is really targeting your rectus abdominis. It also compresses and provides structural support to the abdomen. The rectus abdominis is obviously, as you can see here, what gives you your six-pack. If you have low enough levels of body fat, you should be able to see your rectus abdominis relatively clearly. Everyone's rectus abdominis has this kind of six-pack shape to it. Whether or not you can see it is largely determined by how much fat is sitting on top of it. Everyone's six-pack is going to be slightly different. So what we've got here are bands of muscle with bands of connective tissue in between. And there's going to be differences from person to person in how this looks. So not everyone has a perfectly symmetrical distribution of connective tissue in their rectus abdominis there. Some people will have offset or asymmetrical connective tissue. So their six-pack might look a little bit different from person to person. It can be developed in that you can try to develop the bands of muscle that are in between to make them more pronounced and make them stand out a little bit more. But generally speaking, it's whether or not you can see your six-pack or your rectus abdominis specifically is going to be determined by how much body fat or subcutaneous fat is sitting on top of it. Okay, the next muscle we want to look at, if we layer it up, is your internal obliques. So sitting atop of your transverse abdominis and sitting on top of your rectus abdominis, we have your internal obliques. Now again, if you look at the front here, this is largely connective tissue here, with the belly of the muscle being over to the side here. Okay, so it's not more muscle sitting on top here. This is connective tissue. As you can see, it's white on this side here. The belly of the muscle is inferior and lateral, down and to the side. The internal oblique, if we zoom out there, you can see it's got a pretty complex origin and insertion. It originates on the pelvis, so on this iliac crest here, and down onto the pubis symphysis down here, and it inserts onto the linea alba, that band of connective tissue that we referred to at the start, and it also inserts onto a few ribs there, onto ribs number 12, 10, 11 and 12 there as well. The internal obliques compress and provide structural support to the abdomen, as do all of your abdominal muscles. They are involved in trunk flexion, rotation and lateral flexion. So that's the same set of movements that our transverse abdominis is involved in. We've got our rectus abdominis and our internal obliques. So they are involved in a similar set of movements there. So again, if you do a crunch with a twist perhaps, or a Russian twist, that might help to emphasize the work of your internal obliques. Should be no surprise to hear that if we have internal obliques, we also have external obliques. So here we have this external oblique muscle highlighted. So once again, we've got a large swathe of connective tissue that is lying in the middle here, medial to the belly of the muscle, which is located much more laterally and posteriorly to the side and to the back. If we isolate that muscle there, we see that the origin, so the muscle originates on the external surfaces of ribs 5 through 12. So all of these ribs will have a little bit of connective tissue, a tendon joining this external oblique from these ribs. And then again, it inserts onto your linea alba, which is that band of connective tissue down the middle. And it also inserts onto your iliac crest down here. So this is your iliac crest down here, and it also inserts onto your pelvis. Like all the other abdominal muscles that we have mentioned, the external obliques are involved in compression and providing structural support to the abdomen. They all do that job. And then like your transverse abdominis and your internal obliques, your external obliques are involved in trunk flexion, rotation and lateral flexion. Okay, so they are the muscles that we would see that we can see quite clearly from the front. So going from the deep muscles through to the superficial there, we started off by mentioning the diaphragm. We then added in the transverse abdominis. Then we had the rectus abdominis. Then we had the internal obliques. And then we have the external obliques. So layer upon layer from deep through to superficial there, the abdominal muscles at the front. Now we want to spin around and have a look at some of the muscles that are key to core stabilization, midline stability, but that are located on the posterior surface. So let's strip back a few layers there. The first one is one that you may not have heard of before. It is this really long, thin band of muscle here, which is known as your multifidus. So your multifidus originates on your sacrum and your iliac spine. So if I isolate that, so we can see down here, the muscle originates on your sacrum. So that's this bone at the base of your spine here. It forms your sacroiliac joint with your pelvis, which are this specifically is the ilium. Your ilium. So where the ilium meets the sacrum here, you've got your sacroiliac joint. So the multifidus muscle originates down here on the sacrum and your ilium. It inserts onto every single spine, the spinous process of each vertebrae. So the spinous process, if we look at the vertebrae from the side here, is this bony bit that sticks out at the back of your each and every vertebrae, your spinous process. So the multifidus muscle originates down here and then it inserts. We can see there that little insertion. We can see another one there, all the way up onto every single vertebrae, all the way up to the cervical vertebrae at the top. And we can see the spinous process there of C1 at the top, and we can see the little insertion there where that muscle is connected on. So on each and every spinous process, so every vertebrae all the way up along your vertebral column, the multifidus has an insertion. Originates on the ilium and the sacrum, inserts onto every single vertebrae. Its job is stabilization of the vertebral column. So it's a deep muscle here, but a very, very important muscle involved in stabilizing that vertebral column and prevented any unwanted or excessive movements. A good example of an exercise to target that would be, again, a Pilates type exercise, the bird dog, where you start off on all fours on your hands and your knees, and you raise one hand and the opposite leg straight out behind you. So it challenges the stability of your vertebral column there, challenges your midline stability, and really gets you to engage that multifidus to prevent any excess movement in your spine. A weakness in your multifidus will lead to lower back pain and instability. So it is one that is important for stability and for alleviating pain. A good, healthy multifidus muscle. Okay, next and really the last thing I want to look at is your erector spinae group. So this is a group of 3 muscles that are, again, originate. I'm just going to get rid of it, unselect that. That originates down on your sacrum and on the lower vertebrae, and inserts onto your ribs and your vertebrae. So you'll see now there are a number of different muscles that are involved in your erector spinae group. I have them highlighted there. So here we have the 3 different muscles. Don't expect you to remember the names of them. The longissimus thoracic muscle, the iliocostus lumborum muscle, and the spinalis thoracis muscle, highlighted in yellow there and then repeated on the other side. So these muscles, you can see there the little bands of connective tissue on them all the way up there. So they originate down here on the sacrum and on some of the lower vertebrae here, depending on which muscle it is, and they insert onto the ribs and the vertebrae. So if we go back and have a look, we can see that they insert onto the ribs and onto the vertebrae there. And these muscles, this group of erector spinae muscles, are involved in extending and lateral flexion of the trunk. So keeping your trunk extended or stable, and lateral flexion, so side bending of the trunk. An example to target these muscles again would be your bird dog, a good one, a good exercise to target those muscles there. So that's the last group I want to look at. So the erector spinae muscles is this group of 3 muscles here, repeated on either side. When we're talking about your core muscles, though, we were talking about your ability to have a stable midline. So we get rid of all the muscles there. Your midline, unsurprisingly, is this line down the middle of your body. So we want to be able, in order to move effectively, in order to lift heavy weights, to prevent injury, we need to be able to stabilize our midline. And what does that mean, stabilize your midline? Well, it means that you want to maintain this natural alignment of your spine. And in order to prevent that natural alignment of the spine, you want to prevent any excess forward flexion. You want to avoid any excess backwards extension. You want to avoid any excess lateral flexion to either side, or any rotation movement going on there. So imagine if you've got a heavy back squat, the weight is loaded up there. You want to be able to brace your core so all the movement is occurring at your hip joint and your knee joint, that your core is nice and braced. You are not flexing forward, you are not extending excessively, there's no rotation when you're doing the movement, there's no sideward bending when you're doing the movement. So being able to brace your core to stabilize your midline is another way of saying it, is preventing any of those movements occurring when you don't want them to occur. So it's preventing any excess movement around that core area there. So to achieve that, we've got all these muscles that we just started. So I'll highlight them here as we go along. These are just the major muscles. There are a load of smaller muscles at play as well. But we have the multifidus on both sides. We have the erector spinae group on both sides. Moving around, we have got your transverse abdominis on both sides. We've got your rectus abdominis on both sides. Adding in another layer, we've got your internal obliques on both sides, and we've got your external obliques on both sides. And one very important muscle that I forgot to add in there, of course, is your diaphragm. So there we've highlighted all of the core muscles that are at play here from, I'll just go down. So we've got the diaphragm, and we've got the multifidus muscles. We've got your erector spinae group, and we've got your transverse abdominis and your rectus abdominis. We've got your internal obliques and your external obliques. So if you look there, that is a fairly substantial amount of muscle that is supporting the spinal column and supporting the front of our abdomen here, and almost like a weightlifting belt or a girdle wrapping around us here. So it's this complete set of muscles wrapped all the way around us. I've left a couple of them out there. So wrapped all the way around us to provide that stability. There's my cat coming in to say hello. To provide that stability, to provide that core stability, midline stability. So being able to engage those muscles, being able to adequately contract those muscles in the right way will prevent any will give you midline stability, core stability. And when we talk about core stability, what we are talking about is preventing any excess flexion forward, any excess extension backwards, any excess lateral flexion to the side, or any excess rotation in either direction around the vertebral column or around the midline of the body. So that is what our core muscles are there to do. They obviously are also involved in if we want to brace our core or have midline stability, we want to prevent any excess movement, but also if we wanted to move in those, to perform moves like a crunch, we will use obviously some of those muscles to do that too. If you want to perform a deadlift, you need to be able to brace and stabilize your core. Loads of exercises, examples where these muscles come in. So they are the key muscles or the major muscles of your core and lower back that are used to generate movements, but also to provide midline or core stability. That's where we're going to leave it for today. Thank you very much for your attention. I'll see you in the next one.